Vitamin D and mental health, understanding its role in depression, seizures, and overall well-being. Introduction. Vitamin D is best known for its role in bone health and calcium regulation, but recent research suggests it plays a critical role in supporting mental health and brain function. Studies have linked low vitamin D levels to an increased risk of depression, while supplementation has been shown to improve symptoms in some individuals. Additionally, emerging evidence suggests that vitamin D may help regulate neurological conditions such as epilepsy by reducing the frequency and severity of seizures. With vitamin D receptors found throughout key regions of the brain, this essential nutrient influences everything from neuron growth and neurotransmitter synthesis to immune regulation and inflammation control. Understanding how adequate vitamin D levels impact mental health can help individuals make informed choices about supplementation, sun exposure, and dietary intake to optimize brain health and emotional well-being. Vitamin D and its connection to mental health. Vitamin D influences brain health through multiple pathways, including regulating neurotransmitter synthesis, promoting neuroplasticity, and modulating immune responses. Low levels of vitamin D are associated with an increased risk of mood disorders, particularly depression. How vitamin D supports brain function. Neurotransmitter regulation. Vitamin D helps regulate the production of serotonin and dopamine, neurotransmitters that influence mood, motivation, and emotional stability. Low serotonin levels are linked to depression, anxiety, and other mood disorders. Neurogenesis and growth factors. Vitamin D stimulates the production of nerve growth factors, NGFs, which support neuron growth, repair, and communication. These processes are essential for maintaining cognitive function and emotional balance. Anti-inflammatory effects. Vitamin D reduces inflammation in the brain, which has been linked to depression and other psychiatric disorders. Chronic inflammation can disrupt normal brain function and contribute to mood disturbances. Vitamin D and depression, what the science says. A growing body of evidence indicates that individuals with low vitamin D levels are at a higher risk of developing depression. Meta-analyses of randomized controlled trials, RCTs, have shown that supplementing with vitamin D may alleviate depressive symptoms, especially in individuals with clinically low levels. Key findings from recent studies: reduced depression. Risk. A systematic review published in the Journal of Affective Disorders found that individuals with low vitamin D levels were 50% more likely to develop depression compared to those with adequate levels. Symptom improvement with supplementation. A study published in Nutrients demonstrated that individuals with mild to moderate depression who took vitamin D supplements experienced significant improvements in mood and quality of life. Impact on younger adults. Surprisingly, younger adults are more prone to vitamin D deficiency, with studies suggesting that for every 20-year decrease in age, the risk of deficiency increases by 37.1%. This highlights the importance of monitoring vitamin D levels across all age groups. Vitamin D and seizure reduction in epilepsy. Recent research suggests that maintaining adequate vitamin D levels may help regulate or suppress seizures in individuals with epilepsy. One notable study found that vitamin D supplementation led to an average 40% reduction in seizure frequency among participants with epilepsy. Potential mechanisms: calcium and neurotransmitter regulation. Vitamin D plays a crucial role in calcium homeostasis, which affects neuronal excitability. Proper calcium regulation helps prevent abnormal electrical activity in the brain that can trigger seizures. Anti-inflammatory and neuroprotective effects. Vitamin D reduces neuroinflammation and protects neurons from oxidative stress, creating a more stable neural environment that may reduce seizure susceptibility. While these findings are promising, further research is needed to determine the optimal dosage and duration of vitamin D supplementation for individuals with epilepsy. Sun exposure, the natural source of vitamin D. Sun exposure remains the most effective way for the body to produce vitamin D. When ultraviolet B, UVB rays from the sun interact with cholesterol in the skin, they trigger the production of vitamin D3, which is then converted into its active form in the liver and kidneys. Benefits of sensible sun exposure supports vitamin D. Production, spending 10 to 30 minutes in the sun a few times a week, depending on skin type and geographic location, can maintain adequate vitamin D levels. Enhances mood and reduces depression. Sun exposure stimulates serotonin production, which boosts mood and promotes a sense of well-being. Regulates circadian rhythms. Exposure to natural sunlight helps regulate sleep-wake cycles, improving sleep quality and supporting mental health. However, it's important to practice sensible sun exposure to avoid overexposure, which can lead to skin damage and an increased risk of skin cancer. Individuals with darker skin may require longer exposure times to produce the same amount of vitamin D as those with lighter skin. Dietary sources of vitamin D. While sun exposure is the most effective way to obtain vitamin D, dietary sources can also help maintain adequate levels, especially during the winter months or for individuals with limited sun exposure. Top food sources of vitamin D: fatty fish, salmon, sardines, mackerel, and tuna provide rich sources of vitamin D. Egg yolks. Pasture-raised eggs contain higher levels of vitamin D compared to conventionally raised eggs. Mushrooms. Certain types of mushrooms, such as shiitake and maitake, produce vitamin D when exposed to sunlight. Fortified foods. Many dairy products, plant-based milk, and cereals are fortified with vitamin D to help meet daily requirements. Supplementation. Finding the right balance. For individuals who are unable to maintain adequate vitamin D levels through sun exposure or diet, supplementation can be an effective solution. However, it is essential to choose high-quality supplements and monitor vitamin D levels to prevent oversupplementation. Key considerations for vitamin D. Supplementation. Choose natural forms. Opt for vitamin D3, cholecalciferol, over D2, ergocalciferol, as D3 is more effective at raising and maintaining blood levels of vitamin D. Check dosage and blood levels. Aim for optimal blood levels of 40 to 60 nanograms per milliliter and adjust supplementation based on individual needs and testing results. Combine with vitamin K2. Vitamin K2 works synergistically with vitamin D by directing calcium into bones and away from arteries, reducing the risk of arterial calcification. The role of linoleic acid and vitamin D requirements. Interestingly, individuals who consume high amounts of linoleic acid, a polyunsaturated fatty acid, PUFA, found in vegetable oils and processed foods, may have an increased need for vitamin D. Linoleic acid can interfere with vitamin D metabolism, making it more difficult for the body to maintain optimal levels. Reducing the intake of industrial seed oils and replacing them with healthier fats, such as olive oil and coconut oil, can help support better vitamin D absorption and utilization. Conclusion. Vitamin D is a powerful nutrient that plays a crucial role in maintaining mental health, reducing depression risk, and potentially regulating seizure activity in people with epilepsy. With vitamin D receptors present in key regions of the brain, its influence on neurotransmitter production, immune function, and inflammation control underscores its importance for overall well-being. To maintain optimal vitamin D levels, individuals should prioritize sensible sun exposure, incorporate vitamin D-rich foods into their diets, and consider supplementation when necessary. Monitoring blood levels, reducing linoleic acid intake, and ensuring a balance of vitamin K2 can further support vitamin D's protective effects. By addressing vitamin D deficiency, we can take an important step toward improving mental health, enhancing neurological function, and promoting overall vitality.